So first of all, we apply a little bit of cream and start doing what is called a vaciamiento, emptying. We try to maintain constant contact with the person's skin with our hands. This contact, as I mentioned before, makes everything more predictable. If you break contact, the person doesn't know when you'll touch them again, and there's a surprise factor. So, we always try to keep touching as we move from the outside in, and never lose contact with our hands. See? It's not difficult. Moving outward doesn't have to be done in any specific way. It's a wide movement with the whole palm of the hand. We're just doing a little bit of emptying. Anyone can do this for now, right? You don't need a lot of knowledge of anatomy or physiology. We're not trying to cure anything either, okay? Leave that to the professionals, to the physical therapists. They know how to go beyond this. We can do this gentle kneading for about 5 minutes. Maybe at a slower pace than what I'm doing now. As I mentioned in other massage videos, this context makes everything go a little faster. If you can enter into a slow, leisurely rhythm, it will probably create better sensations for the person receiving the massage. Once we have done this, we are going to perform the technique you will see now. We are going to do it on both sides. I will only do it on this side so you can see it. If I go to the other side, the camera would be in the way. But we are going to do it in both directions. It's with this whole area of the hand. We support it right there on the vertebrae. Here are the vertebrae. Beyond the vertebrae, not on it, but a little beyond. And with the other hand, we add weight, force. Yes. And it's downwards. And downwards, you see that I don't lose contact. And downwards. And downwards. I can also use the thumb and support it with the other hand on the thumb. I support this here so that the thumb is the one that is now going to make this movement, but not by itself, as this would overload the thumb, but with the support of the other hand. And we do this movement. We can play with the intensity, a little stronger, a little looser, asking the person, how is it going? Is it too strong? It is the person receiving the massage who has to guide us. We can also pay attention to their breathing, as I mentioned before, if the breathing is smooth. It's as if we wanted to open up. We do it for a while, 2-3 minutes on one side, and then we do the same. I'm not going to do it on the other side now. We can then perform maneuvers on all the paravertebral muscles. You see the fingers, these 2 fingers, on both sides of the spinous processes up to the base of the skull. We start from the lower back area, and we will rest the other hand to increase the pressure on the fingertips. And here we already abandon, we don't need it anymore, and we go up to the neck. And we press, holding the fingers together, pressing, pressing, pressing. There's a sustained pressure, it doesn't have to be painful. If there's a little click, it's okay, no problem. It may have mobilized some rib or vertebra. If you're doing it gently, there's no problem. We do 20, 30 repetitions. I've never liked numbers, not telling someone how many repetitions, how much time, well. I'm telling you that, but everyone has to see it too. You have to let yourself be carried away by the sensations. It's like when you're eating something and it reaches a point where you don't want any more and want to change and try something else. Well, here it's a bit the same. You have to listen to those sensations that ask for it, call you, tell you that this maneuver is already done. We have covered what we wanted to do. We can continue with this type of longitudinal maneuvers, but in this case, we focus on an intense maneuver. Careful, it doesn't have to be painful, it can be impressive, but not painful. We fix one forearm on the buttock, and the other goes up. We let the weight drop, and if we go out through the armpit and back, and there, and back. As you can see, I make contact there. Back. Back. And well, we can also work on this lumbar area, the lumbar square muscle, and we put both hands in and slowly go up to the spines and up to the lumbar area. And we go in. Not with one finger, not incisive. All fingers together, all at once, and we traction, interact. It can be painful, a little, as I said, never too much. Never too much. And we can do the same in the iliac crest area. It's already the buttock, but it will also help us relax the lower lumbar area. And a little higher up, the whole area of the rib margin. We continue to enter underneath here, but we come out a little higher up. We come out a little higher up, okay. Before we went in the gap and came out lower down, and now we come out higher up. And always leaning on the other hand. This is the same on both sides. I'm only doing it on this side so you can see it, but we're going to do it on both sides. And we're going to finish with a very rich maneuver for the lower back area, especially for the lower lumbar area, in which, with both hands, we're going to open this angle. We're going to pull from the pelvis. On one side, we massage the entire paravertebral area. See? With our thumbs, we go deeper, and then here in the pelvis, we pull. We go back on the sides, we fix the tips of our thumbs and we drag here. See how my hands stick to the skin to pull on it? You need to have a certain amount of grip here. If you've applied too much cream, you may even need to remove it. I have a little extra. It would be good to remove a little bit of the excess to have more grip there, especially more grip. And this is a maneuver similar to what cats do. Cats give themselves a kind of massage like this when they want to sharpen their claws. With the lower palm of the hand here, and one and the other, and one and the other, and one and the other. It's not so much pushing down as pulling. Like pulling the pelvis down. I come from here, slip a bit and pull. Or I come, slip and pull. I come, slip, reach here at the acrylic and pull. Slip and pull, slip and pull. A very, very, very rich maneuver for the lower lumbar area. I think that with these maneuvers, these 5 or 6 maneuvers that I have presented to you, you have more than enough to provide a massage to your partner, your friend, your family member, your mother, a very nice, very helpful massage that will make them feel very good. It will help them relax and feel much better. And well, that's it. I hope you liked this video, that you practice the maneuvers that I propose and that they work well for you. And I encourage you in every way to look for a lot of other videos with massages for the cervical area, the feet, the legs, other areas of the body. You'll find all of that here, on OnSalus Health.